Hey y'all, so let's give Ceftriaxone. I haven't done one of these med videos in a minute, so I'm super excited. Let's hop right on in. So Ceftriaxone, the other name for it is Rocephin, and my patient is getting it for a UTI where he was unfortunately showing signs of sepsis. So I'm giving this med IV push, which basically means that I draw it up in a vial and push it straight into the veins versus having it come through an IV bag slowly. It comes from pharmacy as a powder in a glass vial, and I have to reconstitute it, which basically means I have to mix it with some sort of solution or liquid so I can make this medication liquid so I can push it through the IV. A lot of new nurses have questions like, how many ml do I add and what type of solution? And you should. New nurses that don't ask questions scare me. I like questions. So for you guys out there, just to let you know, you can either look at the back of the vial, sometimes it'll tell you, or you can always look at the order. And if that fails, you can also call the pharmacy and ask them. So this order says reconstitute 1 gram vial with 10 ml of sterile water. And then it says administer by IV push over 2 minutes. Now 2 minutes is actually lightweight. Some IV push meds are over 10 minutes. So if you're a new nurse and you struggle with the patience of pushing it for that long, try to multitask and occupy yourself. So what I'll do is I'll push 1 ml, then I'll scan out the pills. I'll push another ml, then I'll pop the pills into the med cup. Just try to occupy yourself, talk to your patient so that you're pushing it the right amount of minutes because it's important. Okay, so now that we know what we're doing, let's look at our supplies. So I have a 10 ml syringe and then I have my blunt needle. Now, if you don't know what this needle is used for, it can be a little intimidating because it's thick and is not as sharp on the ends. But you know, it's not going into anybody's skin. It's called a blunt needle. We only use it to puncture vials. So basically we can mix stuff together. Now I'm going to show you how I do it. There are multiple ways to be a nurse. There's going to be 11 nurses in the comments telling you to do it a different way. Please take their advice. I do not care. This is just the way that I do it. There are multiple ways to do this, and as long as it's not gross negligence to the patient, please leave me alone. Respectfully, of course. Okay, so I pull back 10 ml of air. Then I puncture the vial, okay? Push that air into the vial, and then the liquid that's in the vial will squirt out because of the pressure that you just placed in the vial with the air. This is the sterile water. If you choose to draw up the sterile water without pushing air into it first, it will still draw up. It'll just draw up slower because you'll have more resistance because you didn't put the air in. No big deal. Both ways are fine. This is just my easier, faster way for me. So I'm scrubbing the hub, and yes, sometimes it is that hard to puncture the vials with the blunt needle. I'm squirting that sterile water into the Ceftriaxone, and you see now that powder is becoming a liquid. Once it's fully mixed and you don't see powder anymore, flip the bottle upside down and put the blunt needle into the tip of the bottle, not in an air pocket. And if you're watching real closely, you'll see the liquid just shot into the syringe. I didn't actually pull back on the syringe until the last couple ml. That's how fast and smooth it comes out. After that, I just squirt out any extra air, make sure I got all of the medication out of the vial, and I'm good to go. If you're drawing up or preparing a medication away from the bedside, make a label with the patient's name and the medication so that you don't confuse it with anything else. Lastly, throw away your trash. Let me show you how easy it is because I'm pool, so I see many of different med rooms, and I'm tired of walking in and they're looking like, who raised y'all? Okay, throw away your trash. Anyway, if you like this video, like and comment, send to a nurse. Let me know what you think.